Hello, this is Dr. Satish Goyal. I wanted to take a few moments to talk with you about your recent fainting spell, or what we call syncope, and our plan to ensure that we are doing everything we can to protect you. We know you have a history of coronary artery disease, and when someone with this condition experiences syncope, we need to investigate thoroughly. Fainting can sometimes be a warning sign of an underlying heart rhythm problem, and our goal is to determine if that's the case for you. This video will explain the next step in your evaluation, an electrophysiology study, and a potential treatment called an implantable cardioverter defibrillator, or ICD. Your heart has its own electrical system that tells it when to beat. Coronary artery disease can sometimes cause scarring or changes to the heart muscle, which can interfere with these electrical signals. This interference can lead to dangerously fast and chaotic heart rhythms, which we call malignant arrhythmias. These arrhythmias can prevent the heart from pumping blood effectively, which can cause you to faint and in some cases can lead to sudden cardiac death. Recent studies have shown that for patients with coronary artery disease, a syncopal episode or a fainting episode can be a significant indicator for a risk of dangerous arrhythmias. That is why I am recommending an electrophysiology study or an EP study of your heart. An EP study is not a major surgery. It's a detailed test designed to evaluate your heart's electrical system. In a special room, we will give you a light sedative to help you relax. We'll numb an area of your groin with a local anesthetic so that you don't feel any pain. Then we will guide a few thin, flexible wires called catheters through a vein up into your heart. These catheters have sensors that allow us to create a detailed map of your heart's electrical signals. We can see where your heartbeat starts, how it travels through the heart, and if there are any short circuits. The most important part of the study is to see if we can induce or bring on one of these dangerous arrhythmias in a very controlled environment. If we can, it tells us that you are at risk for these episodes happening on their own. You might feel your heart racing or pounding for a few minutes, but my team and I will be right there with you, and we can stop these arrhythmias immediately. After the study, we will remove the catheters, and you will need to lie flat for a few hours to allow for the site to heal. If the EP study shows that you are at risk for a malignant arrhythmia, I will recommend an implantable cardioverter defibrillator, or ICD. Think of an ICD generator as a guardian angel for your heart. It's a small battery-powered device that is placed under the skin, usually just below your left collarbone. It has wires called leads that go into your heart. The ICD continuously monitors your heart rhythm 24 hours a day. If it detects a dangerously fast rhythm, it will deliver a high-energy shock to reset your heart back to a normal rhythm. This shock can be life-saving. The procedure to implant an ICD is a minor surgery, and recovery is usually quick. You'll need to limit some activities with your arm on the side of the implant for a few weeks. But after that, you can return to most of your normal activities. Living with an ICD is very manageable. The shock itself can feel like a sudden jolt or a kick in the chest, but it's over in a second. It's a sign that the device is doing its job to protect you. You'll be able to use your cell phone and other household electronics without any issue. We will give you an ID card which you can show at airport security. There will be some restrictions on driving, which we will discuss in detail to ensure your safety and the safety of others. I know this is a lot of information to take in. The most important thing to remember is that we are taking these steps to protect you from a potentially life-threatening event. The electrophysiology study will give us the crucial information we need to make the best decision for your health. Please write down any questions you have, and we will go over everything together at your next meeting. My team and I are here to support you every step of the way.